Good afternoon, everyone. I would like to welcome you and our guests to our September 6, 2022 Board of Health meeting. I would like to remind everyone that our meetings are web streamed and televised, and if you could please ensure that your phones are on silent mode. Starting off today, we are going to move right into the approval of the agenda. And with that, if I could have a motion to approve the agenda as presented. Councillor Huffman, seconded by Board Member Michelle. All those in favor? That's carried. Any declarations of pecuniary interest? Okay, seeing none, we have no consent items. We have no early closed items. We have no deputation. So we're moving on to our presentation from Dr. Strauss, our Medical Officer of Health, with his update. Welcome, Dr. Strauss.
Thank you, Chair Chop. Always a pleasure to address the board through you. Sorry I couldn't be there in person today. Also, I will keep my comments brief. There is concurrently a ministry meeting regarding temporary foreign workers that I hope to attend right after this. So a few points to hit. One, I think the last time that we met, I said that it seemed as though the seventh wave of COVID was peaking. It has peaked, it has come down, it has concluded. I'm happy for that. The only other major COVID news by my lights is that the bivalent vaccine has now been authorized in Canada. The vaccine team is looking forward to getting shots of that into arms, I believe, starting September 12th. For the first 2 weeks, it will be focusing on high-risk settings. After that, they will be making it available more broadly to the general public, and members of the public can check our website for clinic dates as they become available. A lot of news has come and gone about schools reopening. I'm very pleased with the province's guidelines about schools reopening and about the contact and isolation procedures related to schools opening and for the general public coming this fall. So I'm very supportive of that, and of course our health unit will be in line with that approach. Some other points of interest. We had spoken previously at this table about monkeypox. It was a very concerning epidemic. In Ontario, at least, the outbreak seems to have peaked and seems to have started coming down. Locally, we have not had a case of monkeypox in the last month. I'm really pleased for that. And even as the cases have gone down, we continue to get folks vaccinated. So I'm very pleased and proud with that community who's come forward and done the best thing that they can do to protect themselves and their loved ones. A news item that may have caught your attention was about cases of polio isolated in London and New York State. This is extraordinarily concerning. Polio was almost eradicated, surviving mainly in Pakistan and Afghanistan. And prior to the COVID-19 pandemic, it was the dear hope of, I think, everyone in public health that it would be completely eradicated from the globe. So we've definitely taken a step back with that. I have spent a fair amount of time the last couple of weeks trying to understand what our polio vaccination rates are locally. You may have seen a Globe and Mail news report interviewing some other public health units to show that, unfortunately, data about routine vaccinations is in a bit of a state of disarray across the province as resources have been pulled towards the COVID-19 response. We have sent out the ISPA letters to all of the cohorts for whom we do not have data that is up to date. We are receiving responses regarding polio vaccination. We do not have conclusive numbers, but so far the numbers that we have look good, by which I mean, my understanding is at this time of the year, we would normally see a 20 to 30% response rate in the affirmative, and already we've seen a 40% response rate in the affirmative. So I don't know, for those who have not returned their surveys, is there going to be some larger group that is unvaccinated against polio? I dearly, dearly, dearly hope not. Polio is an absolutely devastating disease, particularly for children. So I will be keeping very close tabs on this file, and I beg anyone in the community who is listening to this who hasn't got their children polio vaccinated, either because of the disruptions of the pandemic or for whatever other reason, if you have whatever is causing you, if such a hesitation exists to get polio vaccinated, please call my office. I will call you back. This is really, really important. The last point of business, at a previous Board of Health meeting, we had spoken about attracting more family physicians to the region. What has happened is that a committee has been struck involving family health team leads and hospital CEOs and other interested stakeholders, mainly based in Haldeman. There was some discussion about whether the committee ought to pursue Haldeman and Norfolk family doctor recruitment. But that committee, which I'm not in charge of, I'm merely a member of, has decided to focus their efforts on Haldeman. So I think that from my point of view, I'm interested to see what work this committee does, what recommendations they make, and it may be simplest for interested parties in Norfolk County to work from that model, or it may be that members of Norfolk County will want to strike their own committee. For me, I'm most interested to wait and see, and I think perhaps over the next couple months, the leaders in Norfolk County can make that decision independently. So that's where we are on that file. I'm always happy to take your questions.
Thank you, Dr. Strauss. Questions from the board? Member Huffman, go ahead.
Thank you, Chair Chop. Dr. Strauss, I'm a little confused in terms of the last issue that you just spoke about in terms of the committee for physician recruitment. I thought it was a direction from our Board of Health that we were going to strike a committee definitely here in Norfolk and hope to include Haldeman. So has this Haldeman group worked independently of that direction? Or if you could clarify that, I'd appreciate it.
Yeah, I think the direction of the board was for Haldeman Norfolk, or at least that was my understanding, given that it is the Board of Health for Haldeman and Norfolk. The momentum really came from the Haldeman side, and so well, it had been my hope that that committee, which arose independent of the board's wishes, but which kindly involved me. It had been my hope that this committee, which was struck over the summer in terms of reference, et cetera, would be looking into issues in Haldeman, in Norfolk as well. That ultimately is not what that committee decided. So I'm not the dictator of that committee. I think from my point of view, I would still like to see what they come up with rather than reduplicating their work in Norfolk. But again, it is not. It's not my role. It's I think incumbent on all levels of government to address this issue. So I'm happy to support the work that arises, but to the extent that it's left to me, my recommendation would be to give this committee a couple months and then see if it's something that Norfolk wants to tag onto in terms of their recommendations.
Okay, thank you for that clarification. From my point of view, I would like to see Norfolk move on this quicker than waiting. Obviously, there is some difference between, I know we're amalgamated as a health unit, but in terms of demographics and geographics, there are some differences between Haldeman and Norfolk. This was very important to me in terms of maintaining adequate healthcare levels for constituents of Norfolk County. I can't begin to tell you the number of times in terms of, different posts on social media and people looking for family physicians and individuals moving to the community. And to me, it's a really important part of our infrastructure here that we're able to provide this service for our residents. So I don't know if Heidi really has anything to add in terms of that, because I know that it had been left with staff. So I'll leave it at that. Thank you.
Thank you, Madam Chair. Through you to Board Member Huffman. Certainly, I'm happy to reply. As Dr. Strauss had mentioned, the Board of Health looks at public health matters for both counties, and then there are times in which each county independently decides to undertake initiatives specific for their county. And we know that primary care is outside of the scope of public health, and so it's completely appropriate that Haldeman County would take this on to look at physician recruitment for their county specifically. I think as a next step, what I would suggest is that I can certainly take this back and have some discussions with our CAO and our senior leadership team at Norfolk County and see if, what we might suggest as next steps to Norfolk County Council as opposed to the Board of Health. For Norfolk County specifically.
So just out of curiosity, Heidi and Matt, Dr. Strauss, sorry, the questions to yourself as well. Are you on the committee?
I am.
You're
The Haldeman Committee, yeah, I was invited to join that committee and pleased to be a part.
And yourself, Heidi?
I am not at this point.
So, so from a cost sharing perspective between the municipalities, correct me if I'm wrong, so we brought forward an initiative to include Haldeman County as well at this Board of Health. They've separated on their own. And so now Dr. Strauss is sitting on Haldeman's committee while Norfolk County taxpayers also contribute to that bill with them not wanting us to participate. I find that strange.
So, Madam Chair, through you to the board, in health and social services, there are some times where staff may support one county at times in an initiative that directly supports one county, but most of the time both counties at the same time. So I think that what we would be looking at moving forward would be making sure that any support that Health and Social Services is giving to the issue of physician recruitment in one county, we would be looking to provide a similar or same level of support to the other county to make sure that it's fair. That's what we that's how we approach our work in the two county area. If there is an initiative that is specific to one county over another, then we keep track of that so that we can balance it out in our overall work plan.
That's fair enough. It just seems funny that we've just spent 2 years working together extensively through COVID with Haldeman County, where this board has also advocated to get Haldeman to have representation on the Board of Health like they previously haven't had. And now, family health, it's the same family health team, correct?
So Madam Chair, through you to the board, each county has its own family health team. And then there is also an initiative across the province called Ontario Health Teams, where primary care, addictions, mental health are looking at joining together. Norfolk right now is partnered up with Grant, and I believe that Haldeman was partnering up with another community, Hamilton, I believe, but I could stand to be corrected.
So would it be possible, or what is your thoughts on this, for the board to send perhaps a letter at this point to Haldeman's committee requesting participation in that, given that the hospital CEOs, I mean, there was a need for those hospitals to work together during COVID. We did share resources during COVID, and it seems sort of logical that we would, all participate in this together. And that's really from our end, then it's saving Dr. Strauss's time because he's sitting on one committee instead of two. It's saving your time. And that means then that we invite the Norfolk County Hospital CEO and a couple of others from our end to participate in that. So do you think that would be possible from the board to be able to send a letter inquiring as to either why they don't want us to participate or whether they may be willing to work together?
Certainly, Madam Chair, I think as was discussed, mentioned by Board Member Huffman, I believe, but please correct me if I'm wrong. There are uniquenesses to each county, and I think that that is why the Haldimand Committee has wanted to focus on Haldimand, but certainly if the Board of Health would like to send a letter to the committee expressing what the board sees as the benefits of the two counties working together, certainly that is something that we can draft for your consideration as board chair.
Councillor Van Der Beek.
Thank you. Through you, Madam Chair. I have to concur. I think it's important that we do participate. I mean, we need doctors just the same as Haldimand needs doctors. So I think working together would work well. And sending them a letter, I do concur. I think that's the right thing to do. It's sad that they didn't want to work together to be able to provide that, but I do understand the uniqueness of one county versus the other. But I do have and I will hope that and support that you would send a letter and try to work on working that together. My second, I have a question though for Dr. Strauss, is over the temporary foreign workers. How did we fare up this summer as far as COVID was concerned? Did you have many outbreaks? I hadn't actually followed up completely, but how did it go this summer with the farms?
So certainly there were outbreaks in the migrant worker setting, as there were in basically all settings. I myself finally came down with COVID last month after 2.5 years. So I would say the number, and I don't have the absolute number at the top of mind, but it was less of a number and less disruptive, by my understanding, to agricultural operations. And I am not aware of any hospitalizations that occurred as a result of those outbreaks. And I am very pleased to say that there were no deaths due to those outbreaks. So there have not been any deaths of migrant workers due to COVID-19, I believe, for the year that I have been here, which I'm happy to say. And the bottom line is the vaccinations work, Paxlovid works, and there's a whole lot of work in terms of outbreak management also worked.
Well, that's good to hear. What was the uptake of vaccination? Was there a significant number that received vaccinations?
Oh, absolutely. I don't have the final number, and there's some discrepancies in terms of how those numbers are collated. But every time that we did compare migrant worker to general public vaccination rates, the migrant worker rates were generally higher.
Thank you.
Councillor Hoffman, go ahead.
Thank you, Chair Chop. I'm sorry if I sound like a broken record here, but I'm not very happy right now. We had sent a direction, and there were directives that were sent to staff in regards to getting a committee struck. I was anticipating that possibly this meeting, no later than the October Board of Health meeting, there would be a format for this committee. So we specifically sent a directive to staff. It has been ignored and it has not been followed through on. And I don't know if our CIO can provide, or if Teresa is able to go back and look at the minutes from, I think, a couple meetings ago. But to me, it was very clear, and it was again discussed at Health and Social Services Advisory Committee. So somewhere a ball has been dropped. And my understanding is, I did a little bit of research on my own, and I believe that the Haldimand Committee was struck by some community stakeholders, not necessarily initiated from the council of Haldimand County. And that's where that came from. So again, was expecting that we would have some kind of maybe some terms of reference, or at least members of who this committee was going to involve, and we would get ready to go forward on it. So if I could get a few more explanations, I'd greatly appreciate it.
Heidi, go ahead.
Thank you, Madam Chair. Through you to Board Member Huffman. Certainly it was not the intention of staff to disregard a direction from the board. And so my apologies if that's the way it has been interpreted. We became, while we were working on this initiative as directed by the board, we became aware that there was a community group, as Board Member Huffman had mentioned that was struck in Haldeman. And so recognizing that many, if not all of those members might be on a joint committee, we did not want to duplicate those efforts, which was why as an initial step, we reached out to see if we could start with that committee and expand to the 2-county area. When it became known that that the community of Haldeman thought it best to focus on the uniquenesses of Haldeman County, then that's where Dr. Strauss and I have been talking about how then to move this forward in Norfolk. We're trying to move this forward for both counties, being respectful of the resources that we have and that our community partners have, and not wanting to duplicate or compete with each other. So that's why we are where we are at today. Yes, we have a motion on the books that the Board of Health had directed staff to work on a terms of reference and to put together a committee. If given this new information, if that is still the wish of the board, then certainly we are happy to do that. I am just mindful that we might be duplicating some work, and we might be we might be we don't want to overburden our partners and their resources that they have to be a part of a committee. That's why we were trying to work with what was already started within the community of one of our counties.
The one thing I just, thank you, Councillor Huffman, for clarifying. I didn't realize that it was community members that had struck the committee. I thought it was actually from Haldeman County staff members, so that helps clarify that.
Madam Chair, my understanding is that there are some staff members and community partners on the committee.
Councillor Columbus, go ahead.
Thank you, Madam Chair. And prior to this term of council, several years before that, there was actually a committee set up similar, and it was Norfolk General Hospital that took a lead role in this. They actually had a dedicated staff person for recruitment. It was on a contract, I believe. Last time we spoke, Dr. Strauss, I mentioned that, and I just wonder, have you communicated with Norfolk General Hospital? And I understand that their CEO is also the CEO of Haldeman. So is there any synergy that can be put together here to implement a program on the Norfolk side, including Norfolk General Hospital?
Thank you for the question, Board Member Columbus. So I have been in touch with the new CEO through the work on this committee that was happening. And so it certainly was quite evident to me that if we were to strike a second committee, that roughly half the membership would be the same, and therefore duplicating work and duplicating meetings and those sorts of things. So that's I just do want to point out that the directive was certainly not ignored by anyone. It seemed to me that the optimal solution would be for the committee to expand its mandate. However, the committee's decided not to do that, and that's been a difficult sort of circle to square, I must say. So I think that if a Norfolk dedicated committee is to be created, or a second Norfolk and Haldeman committee duplicating the work of the Haldeman committee, then yes, I think Norfolk General Hospital would, not to speak for them, but would almost certainly want to be involved in that. And yes, the hospital CEO with whom I had contact on that previous committee meeting would be a key partner.
Thank you. Glad to hear that.
Member Martin, go ahead.
Thanks, Board Chair Chop, through you to everyone. I guess my position on this was I would have to agree with Councillor Huffman. I would like to see some terms of reference at the very least brought back to our table to have a staff discussion on this, because while the work may be duplicated, there's going to be no results produced whatsoever in Norfolk County. So although we don't need to draft a second committee right now and start with overlap. I would like to not see the ball get dropped on this, maybe see some terms of reference put together and wrap our head around what a Norfolk initiative then could look like. So it would be my preference to get it back to council for another discussion, but building on some terms of reference.
Anything further?
So may I point out, it may not be my place through the board chair to everyone. I guess an ambiguity that I am left with is it the will of the board, you know, is it the will of the board that there still be a Haldeman Norfolk committee, or acknowledging that a Haldeman committee has been struck, is it the will of the board that there also be a Norfolk committee? And then if that committee is to be specifically pertaining to Norfolk, I guess I just am curious about Heidi's question earlier about if it's a Norfolk specific committee, should it be under the auspices of the board or under the auspices of city council? I honestly don't know the answer to the question, but I'm just remarking on a bit of ambiguity that I'm left with.
Al and I met with the hospital CEO as well recently, and my advice to the board, I think, would be first to reach out on that end and to see whether or not there is the opportunity for collaboration. And then once we know whether they are or are not interested definitively, then we can move on our own if they are not interested, rather than duplicating much of this, both with yourself, Dr. Strauss, the hospital CEO, et cetera, since some of those committee members would effectively have to sit on two nearly identical committees.
And board chair, if I may, so just so everyone is aware, I have already reached out and I have made that request, and that request was denied, I suppose. So I'm not sure if the board wants to make its own request or consider that request as having already been made.
I think we should send a request from the board, and perhaps Al, you could reach out to him as well and get a better understanding of what their opposition is. And then once we know what their opposition is, then the board can make some next decisions. Councillor Vanden Rishi?
Well, absolutely, absolutely, through you, Madam Chair, absolutely. I mean, the initiative came from this committee, from the Board of Health, to set this up. I don't understand what the opposition would be. I think it would be something that Al could work with, or send a letter or whatever, but I do agree. I think it should be one joint committee. It seems ironic. It comes from here and then it ends up getting separated. And yet, Dr. Strauss, you're on a separate committee when it should be part of the whole. So I find it a little bit ironic. I think we should all make sure that we try to have a joint committee, because it's so vital that we have doctors in both counties. So I think try a little harder is my answer to that.
Okay, so how about this then to the board? So we will go ahead, we will send a letter from the board requesting to participate. If not, well, hopefully Al can have a conversation with the CEO and try to get a better understanding of the reasons as to why there is an objection. And if staff understands then in the next week or so, because we won't have another Board of Health meeting for a month, that Haldeman is remains opposed and hospital CEO remains opposed to a joint committee, then staff can use the next couple of weeks before the next meeting to start structuring what Norfolk's committee will look like. Sound good? Perfect. Thank you, Dr. Strauss.
Thanks, everyone.
Have a great day. If I could have a motion then from the board to receive Dr. Strauss's presentation as information. Member Columbus, seconded by Member Rabbits. All those in favor? That is carried. Moving on to the Board of Health minutes from July 5th, 2022. Are there any errors or omissions? Okay, seeing none, then if I could have a mover and a seconder to approve the minutes as presented. Member Rabbit, seconded by Member Vanden Rishi. All those in favor? That's carried. We have the following items of communication before us today. Actually, that's singular. 9.1, Association of Local Public Health Agencies regarding the August 2022 information break. And Heidi, did you wish to speak to that?
No, Madam Mayor, this is just here for the board's information.
Perfect. If I could have a mover and a seconder. Oh, yeah, go ahead.
Thank you, Madam Chair, and through you. My question's on page 12 of our package. In the communication, there's a comment about Public Health Ontario call for proposals, consequences of COVID-19. It says up to $125,000. I believe it involves working with a local academic institution for some grant funding. Can we receive some information back from staff as to whether we are pursuing this and maybe what partners might be involved? It looks like the deadline for submission is quickly approaching September 19th.
Madam Chair, if I could have the opportunity to take that back to our Acting Director of Public Health and our data team, and I can respond to the board by email by the end of the week.
Thank you.
Okay, any further questions? If I could have a mover and a seconder to receive the communication item. Member Michelle, seconded by Member Martin. I think I saw a hand. All those in favor? That is carried. Moving on to staff reports 8.1.1. Heidi, I will turn that over to yourself, I guess, to introduce the report.
Thank you, Madam Chair. Catherine Fanning from Finance is here. This is a report that Financial Services has authored on behalf of the Health Unit as it deals with financial matters related to the Healthy Babies, Healthy Children program. So I will pass the mic over to Ms. Fanning to present the report.
Thank you, Heidi, and good afternoon to the board. So report CS 22067 is the Healthy Babies, Healthy Children Annual Reconciliation Report, which is before you today. So annual funding is provided for the Healthy Babies, Healthy Children, or HBHC program from the Ministry of Children, Community and Social Services. So as a brand new and final step to our transfer payment reconciliation process, a final year-end reconciliation is completed. So during this reconciliation, we compare the ministry's approved funding allocation with the year-end audited information to identify if money is due to or from the ministry related to the program. So we've always done that reconciliation bit. What's new to this process is actually needing to get the board's approval of the reconciliation. So for the 2021 to 2022 program, which ended March 31st of 2022, an allocation of $892,061 was provided to the Haldeman Norfolk Health Unit. Of this amount, eligible expenditures of $705,915 were spent. So that left $186,146 to be flowed back to the ministry due to lower expenditures compared to the capped funding. So having funds to send back to the ministry is definitely not a regular situation for this program, as our overall funding allocations have remained unchanged for this program since 2015. As well, historically, the program has operated at a level that's above the funding envelope that was provided. So as with many regular operations, they were significantly impacted by the COVID-19 pandemic. So the main drivers of the underspending are listed within the package on pages 17 and 18, but due to mileage, changes in the program offering, redeployment of staff to COVID-19 response. So we also had the program manager who confirmed that the pandemic impacts were experienced for us in 2021 were also common with many other public health units. And as operations have resumed back to a more regular operating level in 2022, it is anticipated that the full funding envelope will be utilized this year. So staff don't expect this to impact future funding levels because it was a one-time situation related to the pandemic. The funds owing to the ministry have been set up as a liability to be recovered by the ministry. So this will not result in a financial impact to the counties when the funds are returned. So approval of this report will ensure the last step of the transfer payment process is complete. So I welcome any questions and thank you very much.
Thank you, Ms. Fanning. Member Martin, go ahead.
Thank you, Chair Chop. Through you to staff, when we submit the funding back, is there, I'm sure there is, an opportunity to comment and just articulate exactly what you've just said in the hope that it doesn't impact funding in future years?
Through the chair to Board Member Martin, yes. So there is a comment section where we indicate for any variances, the rationale behind them. So yes, we have indicated that it was a one-time situation related to COVID-19.
Further questions? Somebody wish to move the staff recommendation as printed on page 16? That's that staff report CS 22-067, 2021 to 2022. Healthy Babies, Healthy Children Annual Reconciliation Report be received as information, and that the certification together with the 2021 to 2022 transfer payment annual reconciliation be received and approved. Member Huffman, seconded by Member Vanden Drieschie. All those in favor? That's carried. No bylaws today, no motions, no notices of motion as far as I'm aware. Okay, does any member have any other business? Seeing none, then we have no closed items, and moving on to the confirming bylaw, that would be bylaw 2022-10 BH, being a bylaw to confirm the proceedings of the Board of Health for the Haldeman Norfolk Health Unit at this regular Board of Health meeting held on the 6th of September 2022. If I could have a motion on that bylaw, please. Member Michelli, seconded by Member Martin. All those in favor? That is carried. And finally, Member Huffman, a motion to adjourn. Thank you, at 2:36 p.m., seconded by Member Rabbits. All those in favor? That's carried. So that concludes the Board of Health. We are going to move into public hearings. We'll let everybody take a 10-minute break, and so we'll see you back here at 2:45. Oh, I thought it was listed at 2 o'clock as well. I looked at the agenda. Oh, no, it does say, where did I say? Okay, my apologies, then we'll reconvene at 3 p.m. for public hearings. 22 Public Hearing Committee. I would also like to remind everyone that our meetings are web streamed and televised, and for anybody in attendance, if you could please ensure that your phones are on silent mode. Any declarations of pecuniary interest today? Councillor Van Passen, go ahead.
Yes, thank you, Madam Mayor. I have a deemed conflict on application 4.2, report CD 22076, as I have a family member who owns property within the circulation area.
Okay, thank you, Councillor Van Passen. Any further declarations today? Seeing none, then we will move on to the approval of the agenda. If I could have a mover and a seconder, please, to approve the agenda as presented. Councillor Rabbit, seconded by Councillor Michelle. All those in favor? That is carried. With that, I will now officially open the public meetings held under the Municipal Act, the Planning Act, and County Policy. Please be advised that in order to preserve your right to appeal to the Ontario Land Tribunal, you are required to make comments or provide written submissions prior to the passage of a bylaw. It is important to note that no final decisions are being made on these matters today. These meetings are simply to allow the public to provide initial comments, and further reports will come forward at a later date. With that, we're going to start with CD 22-073. That's application ZNPL 2022198, proposing to amend the zoning bylaw from resort residential to add a site-specific special provision to permit a larger lot coverage. And Brandon, if you would like to go ahead with the report.
Sure, thank you through the chair. Just wanted to take this brief opportunity at the beginning to welcome back our Director of Planning, Tricia Givens, to Norfolk County. She's returned and will be transitioning into our new planning files and planning projects. And just wanted to welcome her back. Familiar face will be around the table into the future. And moving forward, we have Hannah's on the line for this particular application, I believe, and she will introduce it. Thank you.
Thank you, Brandon. Through the chair, I'll just begin sharing my screen. Can everyone see my screen okay?
That's great, Anna-Laura. Yes.
Thank you. So through the chair, the subject property is located at 53 Ordnance Avenue in Turkey Point, south of the intersection of Ferris Street and Ordnance Avenue. The surrounding land uses are predominantly single detached dwellings and vacation homes. The subject lands are designated and zoned resort residential in the official plan and zoning bylaw of Norfolk County. Because the subject lands are designated resort residential and within 120 meters to the Lake Erie shoreline, which has been identified as a provincially significant wetland, they are also within the Long Point Region Conservation Authority's regulatory boundaries. The subject proposal is to amend the zoning bylaw to change from resort residential to resort residential with a site-specific special provision to permit increased lot coverage. The application would facilitate the redevelopment of an existing vacation home. The report submitted as part of a complete application included a conceptual site plan sketch, but no technical reports were required by staff. Standard agency comments have since been received since the preparation of this report, with no significant concerns raised, and no comments from the public have been received at this time. The next steps are that planning staff will be preparing a recommendation report for council's consideration on September the 20th. And thank you for your time. I'm available for any questions.
Thanks, Hannah-Laura. Any questions from the committee? Seeing none, then does somebody wish to move the staff recommendation? Councillor Van Passen, seconded by Councillor Columbus. Any discussion on that matter? All those in favor? And that is carried. Thank you. Moving on to staff report. CD 22-076. This is an application that has been received to rezone a portion of the subject lands from agricultural zone to hamlet residential with a special provision for reduced lot width and lot area and a holding to facilitate the development of future residential lots in the hamlet of St. Williams. I understand Councillor Van Passen has declared a conflict and he has left council chambers. And with that, Mohammed, if you would like to go ahead and present the report, we have your screen up.
Thank you, Madam Mayor. Good afternoon, Council and Madam Mayor. This subject lands with 1.2 hectare of area is located within Hamlet.
Mohammed, sorry, I'm going to interrupt you. I think there's some feedback that's coming through that's making it difficult to hear you. It's still there.
You have your microphone closed. Can you hear me clear now?
Oh, now it looks like, try again.
Madam Mayor, can you hear us clear now?
It's better. It's still there a little bit in the background, but we'll try it and I'll let you know.
So I'll continue. The subject land is in the St. Williams Hamlet area. The total area of the subject lands that is for this application is 1.2 hectare. The lands are located with a frontage of 177 meter along Queen Street East. The site surrounded by mostly low density residential developments and an active farmland at the south side, which is actually a part of the total land owned by that applicant. The official plan designation of this land is hamlet, which permits low density residential dwelling. With that, the other permitted uses are small scale, commercial, industrial, and institutional uses. The zoning is currently agricultural, but as I mentioned, the official plan allows residential development on this land. The development proposal includes 9 to 10 single detached dwelling lots accessed by Queen Street East with 2 parking spaces for each dwellings. A future subdivision application will confirm the number of lots and appropriate development standards. The proposed zoning bylaw amendment will change the existing agricultural zone to hamlet residential. And based on our preliminary review, it is apparent that there will be some zoning relief required. This may include minimum lot frontage and lot area requirements. Staff will require further details of this zoning relief and justification for the recommendation report. So we received a planning justification report in support of this application. Technical comments will be provided during the recommendation report. No public input is received so far. For preliminary consideration for this application, we look at parkland requirements, parking space requirements, traffic, and any impact on the proposed driveway along Queen Street East. We'll also look at the maximum building height and alternatives for private versus municipal servicing. So the next step is to complete the technical review and consider any comments and concerns from the council and member of the committee. A recommendation report will be coming at a later date. That's all for this application. I'll be happy to answer any questions.
Thank you, Mohammed. Any questions from councillors before we turn it over to our guest member, Rabbits? Go ahead.
Thank you. Through you. The application is asking for a reduced lot width. And it's you showed on the map that you just provided, but it's a little unclear on the pages provided to us here. It looks like the lots, even though they're asking for a reduction in the width, they seem to be larger in width than the ones immediately across the street. Can you just provide us some information about the size of the lot widths and what is being asked to be reduced?
Through Madam Chair, to Councillor Ravic, yes, initially the proposal did not include any lot configuration, so it was difficult for us to identify what would be the maximum lot frontage. we received a revised planning justification report that shows 17.44 meter lot frontage, which is much less than what it is required in Hamlet residential area. The requirement is 30 meter. But also if we look at the surrounding areas, there are different sizes of lots. So we'll ask for some more justification how that will fit within the area. And also another important aspect is servicing. So we'll also look at for more information how the servicing will happen. There is a water main line in front of this road, but we also have some servicing constraints. So we'll look at those issues also.
Brandon, go ahead.
Yes, thanks. Through the chair, if I may, just to further clarify that the proponent, who I believe is here with their agent, the application as it is right now, I believe, is just purely to the rural hamlet zone, and the lot width and lot area that are currently in the rural hamlet zone. If it's approved in the future, there may be a subsequent applications to create the lots or to come back with a future rezoning and a subdivision for some of the lands. I believe that's where we're at right now, just so we're clear as part of the public hearing committee. Initially, there was a lot width reduction proposed. That's now to happen, possibly be considered in the future. So what's before us today, then we'll confirm by the council meeting for sure, is the rural hamlet zoning residential minimum lot width.
Brandon, I just have a random question. When you see the one map with the rural hamlet boundary, how does one get, when you see further up would be to the northeast corner, map C on page, I guess it would be the third page of the slide. How does one get, you know, a split on that rural hamlet that's up in the corner, that it's not a continuous block? Or am I misreading that?
To the chair, could you clarify a little bit more?
Do you see on, so page 23, sorry, of 72, to the northeast corner on map C?
Yes.
See how the rural hamlet boundary extends around that area? How do you end up getting rural hamlet block that's separated from the rest of it?
To the chair, it looks like that is zoning already is for that area, whereas there's this portion in between that has remained agricultural. So essentially at some point in time, perhaps with the most recent official plan, the hamlet boundary was designated there, and then at some point in time, the owners would come in with a rezoning, or there'd be a county initiated rezoning to make the whole thing rural hamlet to conform to that official plan. In this case, exactly what this application is doing that. It's proposing to extend and basically connect that rural hamlet zone to conform to that official plan. The other thing that they're also contemplating is future access to that agricultural land to the south. So part of this wouldn't necessarily be create lots all the way along, but possibly reserve land if needed for an access to that agricultural land, and depending on what might happen in the long-term nature of that settlement area as well. So they're reserving some access.
Okay, that's fine. That makes sense. It was just odd with that, the way that block, just in the, I guess, the lines that they had used. But with that, I will turn it over to Mr. Sullivan. Did you wish to speak to the application?
Thank you, Madam Chair, members of council. My name is Mike Sullivan with Land Pro Planning, the agents for the applicant. In response to all the questions raised, Mohammed provided a great overview of the application and Brendan clarified matters. It's because of my client's or our client's specific, I guess, his personal agenda, his personal timeline, that he wishes to proceed with the rezoning first. And as Mr. Sloan noted, future application would come through for a number of lots at that point through a plan of subdivision. We did work with our client on a few concepts, 8, 9, 10 lots, etc. They decided they didn't want to proceed with that at this time, and so came through just the rezoning.
Still staring at that map. Questions from the committee? Okay, seeing it. Councillor Van Rishi, go ahead.
Thank you. Just to pursue, thank you, and through you, Madam Chair, just to pursue this a little further, when I look at the Hamlet zone lines, I guess this is to staff. And I can recognize where you're wanting to do this.
Councillor Van Rishi, can we figure, so we'll direct questions here to Mr. O'Sullivan and we'll members of the public, and if you want to come back for staff questions, we'll do that at the
I'll
end.
reserve that. Thank you.
Any questions for Mr. O'Sullivan? Okay, thank you very much. Is there any member from the public that wishes to speak today? It's been so long since we've had many people come in person, so we'll get you to state your name and address for the record for the clerk.
Yeah, it's been a while since I've done this also, but thank you for hearing my question. My name is Liz Hurst, and I live at 180 Queen Street East, which is next door but one to the lands that are being rezoned on the same side of the street. And I just wanted to clarify Mr. Sloan's comments. So do I understand that this is only the application to rezone? And so any further applications for dividing up the area and et cetera, and traffic concerns, water concerns, is that at a future date, and will we be contacted as residents?
It's a bit of an unusual. Normally we don't normally take questions in such a manner, but I can see how there's confusion with this one. So I'm going to let Brandon address that for you so you know when to come back again. Go ahead, Brandon. Go ahead.
Through the chair, thank you very much. Yes, that is confirmed. So this would be to take the land from agriculture to Hamlet residential, which is the overall plan has always been that it be Hamlet residential zone. That allows a lot that could be a 30-meter frontage, basically about 100 feet. If the owner wanted to build more than one house on that, they wanted to subdivide it in some way, there would either be a committee of adjustment application for a severance, and you would get a public notification for that, and that would go to the committee of adjustment. Or if they wanted to do it in a way that involved a plan of subdivision, there would also be a public application that you'd be circulated. And or if they wanted to come in and further change the zoning to reduce or change anything about the permissions, then also you would get a further notification about that.
And so at the present moment, 30 meter is on the right, on I thought I did.
Thanks. Through the chair, yes. The rural hamlet zone has a minimum lot frontage of 30 meters or roughly 100 feet and a minimum lot area of 1 acre. Now through that, if someone wanted to come in and sever, it is possible they could also propose to have a minor variance to that if they wanted to change that lot area or lot width or any other provision. That could happen at the same time. And a minor variance and a consent, they're both considered by the committee adjustment at the same time as part of the same circulation.
Excellent. Thank you for clarifying that. And I think I finally got the system figured out.
All good? Perfect. Thank you. Does anyone else wish to speak to the application? Nope, you're good. Next one. Okay. All right. In that case, Councillor Van Rishi, you can now pose your question back to staff.
Yeah, thank you. Through you. When I take a look at the boundary line, is there any thought that maybe an adjustment line would be made all the way over to where the other indicated small square of the hamlet is? Just to clean that up. Is there any thought to that? Do we do that at any time, or do you wait for requests?
Through the chair, I would say that typically the Norfolk approach so far has been either through landowner applicant application, or what I would say is most likely is when we do an updated comprehensive zoning bylaw. So when we're going through and updating the bylaw to make sure it has to conform to the official plan, we would make map C look like map B, or whatever map B might look like at that time.
Thank you.
So if I can just follow along with that, this is kind of an aside from the application, but as we look to improve planning procedures and sort of reduce some of these timelines, with that all being already designated, you know, within the hamlet, and we're now just proceeding with a zoning change that really there's very little that council can do to prevent that, given that it's already got that designation. What is the purpose of this coming to council? Is there a way that we can avoid this in the future, given again that it's already within the official plan to be designated as such?
To the chair, thanks for that question, and it actually dovetails very well into something that I'm proposing to bring to council on October 5th. That there is Bill 13 legislation from the province that does allow for the delegation of approval of minor zoning amendments like holding provision removals or temporary use provisions. And this is one of the types that I was kind of grappling with, whether or not this is quote unquote procedural enough and minor enough that it is just implementing this. And this could have been, you know, done weeks ago, but still subject to a public process. So there still would be a public circulation, public comments, and then you could decide, is it a delegated approval or does it need to come to council, spend a few more weeks on reports, etc. So that's, this is an example of something that's under contemplation of whether or not it could streamline.
Yeah, it's something to this end, I think is pretty straightforward. Now, once you get into discussions around, you know, reduced lot size and so on and so forth, then it's absolutely a council decision that would come into play. But just to apply the zoning to an area that's already designated as such, it makes sense that there would be some sort of streamlined process to deal with that. Thanks, Brandon.
Yeah, through the chair, I would agree with that.
Perfect. Hey, any other further questions from council members? Anyone else from the public that wishes to speak one last time? All right, with that, does somebody wish to move the staff recommendation? Councillor Huffman, thanks. Seconded by Councillor Michelli. All those in favor? That is carried. We are moving on now to CD 22-072. We'll wait for Councillor Van Passen to rejoin us. And there he is. I'm sure he went outside to get some fresh air in the meantime. All right, so CD 22-072 application ZNPL 2022197, proposing to amend the zoning bylaw from agricultural to hamlet residential with a site-specific provision on part 1 and from agricultural to hamlet residential on part 2 of the lands described as 4671 Highway 3 and Renton. And Hannah-Laura, we've got your screen up and we're ready for your presentation.
Thank you, Madam Chair. So the subject property is located at 4671 Highway 3, near the hamlet, or in the hamlet of Renton, west of the intersection of Cockshed Road and Highway 3. The surrounding land uses are predominantly single detached homes along Highway 3, with agricultural land surrounding that hamlet area. The subject lands are designated hamlet and agricultural in the official plan and zoned agricultural. There is a relatively minor portion of significant woodlands which run parallel to the eastern lot line. The proposal is to amend the zoning bylaw on the subject lands to facilitate a future severance for the lands identified as Part 1 in order to construct a single detached dwelling. The site-specific provision proposed is to facilitate the development of a single detached dwelling on the future lot to be severed, which is identified as part 1 on this map. The reports submitted as part of a complete application include a conceptual site plan sketch and a planning justification report. No technical reports were required. Since the writing of this report, we have received the following agency comments. So the Ministry of Transportation has provided a formal comment, which has since been provided to the agent. We will review this direction prior to the finalization of the council recommendation report and bylaw. The MTO stated the proposed severed and retained lands will have insufficient frontage to maintain safe access from Highway 3 and have requested that the entire subject lands be rezoned to only permit a single detached dwelling as a use in order to grant a future entrance permit for the newly severed lands and the retained lands. The MTO has also reviewed the draft bylaw and confirmed it will not satisfy the MTO requirements noted earlier. Development engineering has stated that they will require a standard lot grading plan and has confirmed that an entrance permit from the MTO will be required for the lands to be severed. And the zoning administrator has noted that a metal shed on the lands to be retained will not meet the 1.2 interior lot line setback. The applicant has confirmed this will be addressed, and staff will address this during the consent process. Since the writing of this report, one comment from a member of the public has been received at this time, which discusses the potential impact of development on the trees noted on the eastern lot line, and that fill has been placed on the site. To address this concern, the effect of the site-specific provision will ensure that development is not permitted near the significant woodlands on the lands to be severed, which are those trees on the eastern lot line. The MTO has also been notified by staff of the report of fill being placed on site, and they are working with the applicant independently to address this concern. Next steps are that planning staff will be preparing a recommendation report and reviewing the comments as received for the final bylaw for council's consideration on September 20th. Thank you for your time, and I'm available for any questions.
Thanks, Anna-Laura. Questions from council? Okay, seeing none at this point, is the applicant with us today? Did you wish to speak to the matter? Okay, does anyone else from the public wish to speak? Yes, no, yeah, go ahead.
Thank you, Madam Chair and Council. I'm Scott Plandre with G. Douglas Valley, acting as the agent on the applicant's behalf. I think some important information for this application, particularly the willingness of the applicant with the 10-meter setback from that easterly property line to respect the significant woodlots on the neighbor's property. In regards to the MTO issues, it's important to note again that we did apply for a pre-consultation meeting with the county to discuss such issues in terms of they've now advised of the entrance issue and the rationale behind why they don't want intensified use on the property. During that pre-consultation, they didn't provide us with comment until we made actual application. And it's an interesting perspective here when we're stuck between a rock and a hard place between two ministries. We have the Ministry of Municipal Affairs and Housing telling us there's a housing crisis and we need to intensify development where development should take place, which is these types of hamlets and built up areas. And then we have the Ministry of Transportation saying, no, these don't meet our guidelines. You can't do this unless you meet these requirements, even though we've met all the Norfolk County zoning bylaw requirements in terms of lot frontage, lot area. So it kind of becomes a tricky challenge trying to navigate the ministries, the labyrinth of ministries and their requirements, depending on who you talk to and when. So the applicant has worked, and we thank Hannah for her work back and forth, trying to make sure we're facilitating this. The applicant is seeking to move their aging in-laws to that lot, so that would be the purpose of the construction of that single detached dwelling. In general, obviously, the reduction of, it seems the Ministry of Transportation's issue is with an intensification of use in the area. The applicant is amenable to the requirements of the MTO, although I do believe it is important to note that the MTO seems to be going a little bit far in their requirements of, essentially sterilizing these lands for what would otherwise be important housing uses in Norfolk County. Other than that, I'm more than willing to answer any questions that the committee may have.
Questions for council? No? Okay, thank you very much. I have a question about that, Brandon. Actually, I agree. I find the MTO's decision-making process actually quite interesting lately. So when we go to redo the official plan, is the MTO given the opportunity to provide comment at that time? Like, to me, what's the point of having all of those designated hamlet areas, i.e. to the south? So we have a chunk of land that could have 1 acre lots that conforms with our official plan in that area, but we're going to have the MTO say every time that we can't do that. So they just get to pick and choose where they're going to allow development to occur, and it's not going to be up to the municipality.
Through the chair, we definitely have a number of questions for the MTO on this. I know planning staff even coordinated a meeting with all the ministries to kind of talk through this topic, because we have the additional dwelling units coming to council as well. And as the applicant, as agent noted, we have a significant housing challenge. And so housing is an important priority. To answer it, yes, the MTO has a part in reviewing the official plan. I would go one step further, and the rural hamlet zoning has a category that was applied in Norfolk as well, that MTO would have reviewed that zoning when put in place for the lot width, the lot area, but also the location of where the rural hamlet would be along with the official plan. And so there was no, I guess, comment or appeal at that time from MTO. It's definitely a topic that we are going to take into consideration for the council report, because the rural hamlet zoning as it is right now allows for a single detached and an accessory residential unit. So anyone in one of these properties along here on this same frontage right now could come in with a building permit to transition their basement into another unit.
Just that MTO won't let them put a driveway.
If they use the existing driveway, then the MTO, I don't believe, would involve.
I think if there's something that you think from council in the future, whether that's some sort of a letter or something, as we go into a new official plan, if they have a problem with other designated hamlet areas that have been designated as such, then I think we have to consider either taking on that battle or moving, removing some of that designation in some areas and reapplying it to other areas where it can actually be used.
To the chair, yes, that would be helpful if we can work together on that and with our provincial partners on what the overall objectives are. And you're correct, that might help a little bit with the new official plan updates, as determining where's the best areas for growth then, and finding ways that MTO can still have their proper jurisdiction for their access permits.
So if there's a letter or something between now and the meeting in October, when you're bringing forward some of those planning changes and so on, if you were to put some thought into that, we could provide that from council at that time. Okay, with that, are there any other questions? Councillor Van Passen, go ahead.
Not really a question, a comment on your suggestion, because I believe history will let us know that, and maybe Columbus can help me on this, that the last time we redid the official plan, we had requested to expand some of the limits of the hamlets, but we were turned down by Ministry of Municipal Affairs because we already had enough designated land in the hamlets. But if the MTO won't let you build in those hamlets where the designation is, what's the point of having it? So I think putting a little pressure on the different government ministries to get on the same page might be helpful. Thank you.
I think it goes along with some of the challenges that this council had in the beginning, where when pre-con, and this is before your time, Brandon, but we would, the when applicants would come forward for a pre-consultation meeting, it would be circulated to other departments. And we kept having reports come to council with, no comments at this time from such and such department, no comments at this time from such and such department. And we had a, kind of a new policy from council, speak now or forever hold your peace kind of thing. You've got your opportunity to go and articulate your problems with it. And, if the MTO doesn't articulate it at a time, to me, that's a done issue. Anything further from council? Okay, with that, if I could have a mover for the staff recommendation, Councillor Huffman, seconded by Councillor Vandendriessche. All those in favor? That's carried. Next application is final one, and that will be CD 22-078, application ZNPL 2022202. Proposes to change the zoning of the subject lands from general industrial zone to urban residential type 1 and urban residential type 2 with a special provision to permit 1 single detached dwelling and 6 semi-detached dwelling units for the lands described as 166 Metcalf Street South. And Mohammed, we have your screen. I will turn it over to you.
Thank you, Madam Mayor. So, Madam Chair, this subject lands with 0.367 hectare of area site is located within the urban area of Simcoe. It has a frontage on both Metcalf Street South and Stanley Street. The street is currently used as a print shop, surrounded by mostly low to medium density developments, including semis and townhouse dwellings. The official designation of this subject land is urban residential, which permits various range and density of mix of housing. The zoning is currently general industrial with a special provision that restricts transportation and vehicle related industrial use and material manufacturing at this moment. The development proposal includes 1 single detached dwelling and 6 semi-detached units. 2 parking spaces are proposed for each dwelling unit, and this is as per the zoning bylaw requirements. The proposed zoning bylaw amendment will change the zoning from general industrial zone to urban residential type 1, and this is for single detached unit, and urban residential type 2 for 6 semi-detached units. A special provision is also requested to get some relief of required minimum lot area, minimum lot frontage, and minimum exterior side yard setbacks. So for the single detached unit, the requested minimum lot area is 266 square meter, whereas 360 meter is required. The minimum lot frontage requested is 9.90 meter, whereas 12 meter is required. For the semi-detached units, the requested minimum lot area is 175 square meter, whereas 255 square meter is required. And minimum lot frontage is 5.5 meter, whereas 6.6 meter is required. We have received various reports, including a functional servicing report. Sorry, I probably missed the slide. I'm going to start again. So we received various reports in support of this application, which includes a functional servicing report and a traffic impact study. Staff has reviewed the reports and the proposed development. The wastewater modeling has been completed, and staff confirmed that the proposed development meet the design requirements for fire flow and required volume of water. A holding provision is also recommended to confirm the water allocation and the capacity. Staff also requires a record of site condition before the holding can be removed, as the site is an industrial use at this moment. No public input has been received so far. Staff identified few preliminary considerations for further review, the application towards the recommendation report, and this includes the calculation of cash and for parkland dedication, and then the parking requirements. Also, the proposal will look at how it is contributing to the current housing market. The reduced lot frontage from 6.5 meter to 5.5 meter will also be reviewed, as that may create some challenges for servicing and utilities. We'll also look at the building height, water servicing and services, and as I already mentioned, the record of site condition that will be on place according to the wording. So the next step is to get the comments from the public and from the council, and we'll complete our technical review and we'll go for a recommendation report at a later date. So that's all from me. I'll be happy to answer any questions.
Thank you, Mohammed. Questions from councillors? Councillor Columbus, go ahead.
Mohammed, I've raised this question before. It's with respect to street parking. And we've got a lot here that's 0.367 acres, just over a third of an acre, and 6 semi-detached units, 1 single detached unit. And is there any concern about snow removal and parking on the street? Is there adequate parking if somebody has a visitor out of any of those 6 lots, in particular those 6 semi-detached? Is there adequate parking on the street for visitors?
So when I checked with the councillor, we mentioned that the request was for a reduced lot frontage, and for the semis it will be 5.5 meter. I mean, the standard requirement is 6.5, so there'll be a reduction, and that reduction will probably cause reduced snow storage facility at the front. So from that perspective, yes, there might be some impact, but we'll also look at the surrounding areas and other spaces where the snow can be stored. So in some cases, we see the exterior side yet has lots of space to provide snow. So we look at the other areas of this subject land where the snow can be stored.
Okay, thank you for that. I'm always concerned that these applications should be run by the operations department or the roads department for comment. Thanks.
Any further questions? Councillor Van Passen, go ahead.
Thank you, Madam Mayor. In more of a comment, but in the staff report, it's page 64 of 72 of our agenda, the conformity with the official plan. The planning comments speak to the proposed 299 unit development. I'll just assume that's a typo, and it should be 7. Might make sure they read that.
To Madam Chair, to the councillor, yes, we are going to correct these numbers.
Thanks, Mohammed. Further questions from council? Okay, are you the applicant or the agent? No. Do you wish to speak to the application?
Yes, Bob
Sorry,
Phillips.
Oh, my apologies. Just one sec there. Sorry, the agent's online?
Yes, I am. Bob Phillips from Cahoon Engineering. We certainly heard Mohammed's presentation. Have really no issues, and I'm just here to answer any questions you might have at this time.
Any questions for the agent from council? Okay, seeing none, you can head to the podium. Welcome, and if you could just state your name and address for the record for the clerk.
My name is Vera Evans, and I live at 162 Metcalf Street, which is on the corner of Metcalf and Stanley, that little block that's out of there. My concern is the stone coming down, and also I might be interested in selling if I got the right price for my land.
Okay, well, I'm sure the applicant's agent's on the phone, so I'm sure they heard that. Can you just clarify what you're talking about in regards to the stone? Your concerns? I just don't understand your
It's a
concerns.
net lot, right? It's a huge building, like on two sides of me. I'm just scared for when it's down.
For when they demolish it, you mean? Okay. I'm sure with their demolition permits and everything that they have to go through these days, that that will be well looked after. Brandon, did you want to provide any comments?
That's correct through the chair, that through the demolition permit, they would have to make sure that everything is safe and on site. And I think we would ask the applicant to give you adequate notice in addition to whatever the standard requirements would be. I would note that the building is close to the lot line, so it's definitely a question to be asking.
Perfect. Thanks for coming. Does anyone have any questions from council? Somebody wish to move the staff recommendation? Councillor Martin, seconded by Councillor Vanden Rishi. All those in favor? And that's carried. And I believe that is it for today. So if I could have a motion to adjourn, please, Councillor Huffman, thank you. And seconded by Councillor Michelli. All those in favor? That's carried. Public hearings is adjourned and we will see you guys back next Tuesday.